Hi there, folks. This is Dr. Ellenburg. Welcome to my medical show here on Fox News Talk 1020 AM. Also find us on FM at 95.5, and you can also live stream us online at foxnewskoan.com. That's foxnewskoan.com. Again, some reminders. This is a live call-in medical show. If you have questions about your health or questions about our topics in medicine, please give us a call. We do encourage phone calls here. It is a live show, of course, and our number here at station is 522-1020, 522-1020. Some reminders about how you find me during the week. You'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com, and that's DRELLENBURG, drellenburg.com. Check us out, list of our services. We also have a list of websites you might find enjoyable to learn more about your health and things out in the environment. And that means anywhere you sleep, breathe, and eat these days, not just outdoors, also your home. Remember, one of the largest areas of pollution in the world these days is inside your house, of all places. But on our site, we also have archived radio shows and a list, a small list, that is, of suggested reading materials. I need to update those because I have a lot more good reading I've been doing over the last year that I could put on there, books that I've read. Or typically, if they're about medicine, you're going to hear about here on the show anyways. And we'll talk about that as well as we go along. So again, drellenburg.com. I do see patients in Kenai and Palmer at certain times of the month. Our office knows those dates, of course. They do change, and our number at the office, again, is 563-2366. All right, well, today we're going to talk a little bit about lung cancer screening. We're going to talk about specifically a diet that many of us probably have heard about but don't know what it means to hear what it is, but that's called the Mediterranean diet, and what are the benefits from following that type of diet. And this is the case, not so much a diet to lose weight, but a diet for eating healthy, all right? We'll talk today about a very interesting study that came out of New Zealand looking at the vitamin D status of breastfed infants that were only being breastfed, only not being getting, of course, any supplementation of any kind. We'll talk about a link that has been getting some credibility in the last few studies that's come up, and that is a link between taking aspirin and developing macular degeneration or age-related macular degeneration. That's an eye disease you don't want to get. That many Americans do get, unfortunately, and it can cause blindness. We will also, within the context of the diet, for Mediterranean diet, we'll be talking, of course, about various aspects of salmon and fat and a variety of things that are good within that diet that you want to be focusing on in general, not just Mediterranean diet, but in general for your health. Talk today about kidney disease, and I also want to talk today, where did that go to? I had a little extra note I added on. Well, we'll see how far we get. May have another topic I'll be adding in because it's a little short here, my little list of things to go over. So we'll see where we get today as far as that's our big topics. One area I do want to get back to, and I know that over the last few weeks I have mentioned that there was proposed regulation changes, from the Alaska Division of Businesses, Corporations, and Professional Licensing that have been proposed to put certain restrictions on the practice of naturopathic medicine in the state of Alaska. And again, I focus on this because I'm a naturopathic doctor. So if this changes were to go through, they would affect my business. They would affect who can see me and the care and treatments I've been providing to Alaskans since 2004. Well, the time for comment on that particular proposed regulation changes has passed. So no more exact comments can be made specifically to the state. So now we're going to wait and see what they're going to do. Hopefully we'll find out within the next month if they make any changes at all. Hopefully they'll leave it the way it is, and they won't make any changes. We had approximately, I think, somewhere around 3,000 responses. I do thank all Alaskans out there who, during that time period, did send their responses into the state of Alaska telling them how they felt about the changes being proposed. And the bottom line is, and you didn't catch it last week on Tom Anderson's show, he's on, of course, the station as well, Monday through Friday, is that we talked about a restriction on health care in the state of Alaska. And so even if you've never seen a naturopathic doctor, you might want to someday. And if these type of changes go through, they're going to restricting your availability to all types of health care available in Alaska. Well, now the focus for the next several weeks on the show is going to be a small bit, and I hope you can deal with this while I get through this part, but we're going to be going over House Bill number 7 because that's a House bill that specifically, again, is being initiated to put restrictions on certain things that we do as naturopathic doctors here in the state of Alaska. It's House Bill number 7. And to make a response, we don't have any kind of letter written up currently, but we are encouraging anybody out there who would like to make a response to the state, specifically in this case, legislative effort taking place against us, is to go to State of Alaska's site. And so a direct link to their site, it goes either the House or Senate, is this House, house.legis.state.ak.us. And for the Senate, to send in a note to your senators, tell them to be against this bill. If it makes it actually into the Senate, right now it's only in the House. It's in Labor and Commerce currently. As in the Senate, you want to contact them, and that would be Senate, senate.legis, legis.state.ak.us. And that's to make comments about Health Bill number 7, which is proposing changes to naturopathic medicine scope of practice here in Alaska and would put restrictions upon our practice. It's not a positive bill in the slightest and would be a detriment to all practicing naturopathic doctors here in the state of Alaska. So please make comments. As time goes on, if we have anything that makes it easier for you to make comments, we will let you know. So with that said, let's move forward against Dr. Michael Ellenburg. If you have questions about your health or questions about our show today, medical questions, of course, are what we're talking about, give us a call here at 522-1020, 522-1020. Okay, well, something that we don't talk a lot on the show about at times is what type of screenings can be done for cancer. And there aren't a whole lot of things out there that, there are preventative screenings, obviously. So let's pick a few ones we'll actually remember and realize they're quite popular. For example, breast cancer screening, that would be using a mammogram. You can also use thermography, which looks at temperature changes in breast tissue. And remember, men do get breast cancer too. So also with of course, breast cancer screening is women doing monthly self-breast exams is an important thing to be doing, as well as seeing a provider to have a yearly breast exam done by a provider. And in fact, there's been a few different studies that demonstrated that actually self-breast exams by women themselves directly and yearly checkups with their providers actually find more cancers than mammograms actually find. Ones that should actually be treated. Let's put it that way. And that's another story we'll get into at some other point in time. So we have mammograms, we have self-breast exams. Of course, you do have prostate cancer out there, and screenings for that typically are a digital rectal exam to actually palpate the posterior lobe of the prostate. The blood test for PSA, which stands for prostate-specific antigen, PSA, hasn't been the best marker of prostate cancer in men over the years, and there's been several studies that demonstrated it is not effective for that. You could have a normal PSA on a blood test for men and still have prostate cancer. It's been shown over many times. So it is important, though, if your PSA does go up quite a bit from one year to the next. That is known as PSA velocity. If that increases very quickly, then it'd be worth going in and seeing your urologist and having a workup and going from there. There is another test that's come out that's more actually geared towards men who may have been concerned for having prostate cancer, had a biopsy done by their urologist, and there's a test called CPA3. Sounds strange. CPA3, which can be a test. It's a gene test that might indicate for a man to have another biopsy done if it were to come back positive. And that test is being done currently, and it's not overly expensive, but it is not a test to be done initially at this point in time to look for prostate cancer. Colorectal cancer, colon cancer, of course, a gold standard for that for screenings would be, of course, getting after age typically 55 or even earlier, if you have colon cancer in your family, is to have a colonoscopy done. We basically have a camera that goes up, that snakes up the whole length of your large intestine, have a look-see, looking for polyps or anything that looks suspicious. Some big ones there. So we have some cancer screenings going on. A lot of areas where you don't see a lot of imaging taking place tend to be with lung cancer. And this is kind of getting back to this current topic here today, is that the American Cancer Society is weighing in, so to speak, here. This article came from Medscape, and it's appeared in the Cancer Journal for Clinicians this month. It says ACS, and this is not the Alaska Communication System, this is the American Cancer Society. ACS weighs in on CT screens for lung cancer, computed tomography. So CT scan is an imaging technique. It does use radiation. Okay, so let's make that very, very clear. This type of imaging technique for lung cancer screening has been out for several years, and it uses a very small amount of radiation. It can provide a very good picture of lungs. And they're recommending that first of all, having a cancer screening center that does a lot of these things is really important. Don't just go to a place that does someone up and they got brand new folks, don't see these things. Go to a place doing this for some time. Instead of recommending anybody should be talking about lung cancer screening is who exactly? Who would people discuss about lung cancer screening? Well, specifically in patients between age 55 and 74 years who have at least had a 30-pack year smoking history or currently smoke or have quit within the last 15 years and are in relative good health to have this test done to look for any suspicious things that might be showing up in someone's lungs. Again, it's a very, very short CAT scan. Does not require an injection of any type of radiological agent, so you're just being exposed to a small amount of ionizing radiation. However, it's quite small, and the benefits of screening in this case, I believe, do outweigh the hazards of having this done. If you are in the group that will require lung cancer screening, again, those are folks who've had quite a long year history of smoking, currently smoke, or have quit in the last 15 years. If you quit when you were 15, you're 30, probably wouldn't recommend doing it. But if you quit when you're like 45 and you're 60, yeah, be a great idea to be having this done. And specifically, too, some reminders that some people don't tend to know this is that the guidelines existing for American Cancer Society do not suggest getting a chest X-ray. It used to be kind of a gold standard in the past for lung cancer screening because it's not an effective tool for finding lung cancer. It is an effective tool for looking for past tuberculosis infections. And it's still commonly used even by a number of groups in the U.S. as far as screenings to rule out TB infections, or old TB infections, that is. So the reminder is, in this case, is using some low-dose CT scanning, in this case computed tomography, could be a benefit in looking at lung cancer and finding things sooner than later. Lung cancer is not an easy, and I'm not an oncologist, but I have seen, unfortunately, a lot of lung cancer patients. And lung cancer is very, very hard to beat. It is very, very hard to treat. It's something that, oncology-wise, we're not having a whole lot of, I'm not saying we as a group, but medicine's not having a whole lot of success in treating that. And that's certainly a major deal. And so to find it sooner than later, the better. And, this type of technique, again, lung cancer screening, excuse me, folks, my computer's deciding to really harass me here and not even work right now. Let's see what's going to happen. Give me a second here. One more time here. I've got some stuff in my head. All right, well, we'll just do this from the head today. Looks like my computer's not going to be helping me out very much. So that's our bit on lung cancer screening. Let's talk about the Mediterranean diet. So the Mediterranean diet, it's been around, for a long time. There is not any specific, when did it start? People eating a certain way. It's based on a diet that many Greek people have eaten for a long time, and tends to include a lot of fruits and vegetables, healthy oils, specifically things like olive oil. What else we got in there? We've got suggestions that, moderation in drinking of wine. Now, we're not suggesting that people go out who don't drink to start drinking by any means. However, it seems that when they say moderation within the Mediterranean diet, we're talking about things like a 5-ounce glass of red wine once. They're saying averaging per day. Now, and again, it's not suggesting to go there and drink, but this is kind of part of the whole picture. So, very low in red meat, a fair amount of fish, oily fish, by the way, sardines, anchovies. They don't get a lot of salmon over there in Greece, but we can certainly put salmon on the list for a Mediterranean-type diet. And as Alaskans, that's an easy one for us to do because we have still, fortunately, have quite a bit of salmon in this part of the world. Not like it used to be, but we certainly still do. And, as far as the servings per day, suggestion, of getting 5 to 7 servings per day of fruits and vegetables. Concerning oils, always a very interesting topic to bring up, and looking at what should we be consuming as far as oils. Well, you have what's known as polyunsaturated and monounsaturated fatty acids. And a big thing that we look a lot in humans, and when we look at healthy oils from our diet, is looking at essential fatty acids specifically. And essential fatty acids mean your body does not make them. And those main ones tend to be omega-3 and omega-6. Oils that kind of fall in line with omega-3, because there's a huge debate among the medical profession as a whole concerning nutrition, this debate that is that do we get enough actually of omega-6 versus omega-3? And for a long time, many providers have said, well, we get a lot of omega-6 from salad dressings and fried places, not a whole lot of omega-3 oils, which come from what? Things like flaxseed oil. Fish have omega-3 fatty acids in them, for example. Okay, sardines have that. Krill oil is omega-3 fatty acids. Flax does contain both omega-3 and omega-6. However, with the Mediterranean diet, we certainly do see a lot of consumption of monounsaturated oil. I believe it's monounsaturated, and that's olive oil, which is kind of like omega-9, oleic acid, O-L-E-I-C, oleic acid. And that has been a mainstay within the Mediterranean diet for a very long time. It's not specifically an essential fatty acid, but our body can still use it for a variety of good things, and it's full of a nice healthy oil for our system. And they're typically recommended in the Mediterranean diet that you would have less butter, certainly no margarine whatsoever. In my opinion, margarine is garbage, but real butter, for example, or with olive oil. In fact, I've even heard suggestions of taking olive oil and butter, and this on a very low setting to actually get the butter to melt slightly, and then adding olive oil and letting that harden up, and you're using a butter made out of olive oil and butter, okay? And if you're going to consume butter of any type, I would suggest be sure you're consuming organic butter. At least you're hopefully they're trying to avoid any types of steroids and antibiotics that the animal may have been treated with when they were in the factory, gathering milk from them. So the oil part of the Mediterranean diet is specifically leaning more towards olive oil. The site, luckily I read these things a couple of times before I get on the air, so most of this is in my head. But they had on their suggestions for oils, olive oil, and they had canola oil. Not really a big fan of canola oil, heavily processed. What are some healthier choices besides canola oil? Walnut oil is a very good source of omega-3 fatty acids and omega-6 as well. Of course, you mentioned flaxseed oil. When we talk about things to cook with, we don't tend to typically recommend people consuming, foods that are fried, using oils that fry things. Typically, they aren't really good for us, so we don't tend to even recommend those direction. If you're going to use oils to cook with of any kind, obviously coconut oil can be used at a fairly high temperature if needed, or a saute, for example, where with olive oil, you probably wouldn't want to go much above low on your stove. That starts turning into, actually, it ruins the fat itself and does not make it healthy for you. On top of your food, great idea, right on top of it, for a variety of things. With the Mediterranean diet, people think, oh, that means pasta. I thought pasta was bad for us. Well, whole grain pasta, okay, not refined, heavily processed pasta. That would be a better choice any day of the week. And the big issue in that direction these days with trying to eat like a Mediterranean diet is that there is this whole gluten business going on, gluten allergies that are definitely on the rise. We're not quite sure why that is. Some concern is the fact that the GM wheat has infiltrated quite a bit of the wheat crops throughout the U.S., and maybe that's why people are reacting more to wheat more than ever. I mean, I've been involved in this profession now, over 10 years, and I certainly have never seen so many gluten-free things available or seen so many folks coming around who seem to have a gluten sensitivity. I don't mean celiac disease. I mean a gluten sensitivity where if they eat a lot of bread products or pasta products or whatever, they end up having a fair amount of gastrointestinal problems, just don't feel right. So definitely this part of the Mediterranean diet needs to be taken with caution, and I'm not recommending a high use of pastas other than getting more whole grain type pastas or whole wheat type pastas instead of heavily processed and rich flour type pastas. We mentioned little red meat. They're suggesting no more than say twice a month. We could argue about that in Alaskan. If you are an Alaskan who does hunt and eats moose or caribou or have a chance to get a buffalo somewhere, for example, probably could have those a little more often in a month than your typical beef. Because it's coming from a natural source from out in the woods, out in nature, and not being processed, other than by you or who you take your meat to if you get it processed at a local facility. So I'd probably suggest on the game part there, you could probably increase that amount. Besides eating red meat, how you get protein that's from a meat source, poultry, things like turkey, for example, or chicken. And again, I would recommend free range and all those things, and specifically with chicken, organic chicken. Even with free-range chicken, a lot of times they're still using arsenic in these animals to rid them of parasites, make the meat white and plumpier, and I'm not making that stuff up. Those are kind of some of the big things. And long-term, when we're looking at the use of the Mediterranean diet, is looking at, what are some of the benefits of cardiovascular disease, and that's where we start seeing some of the big things come down. So, those high amount of oils in this diet, really great for being anti-inflammatory towards cardiovascular disease, trying to decrease stroke risk, decreasing heart attacks, improving blood flow in the body, and being anti-inflammatory. And as you know, inflammation is key in all different types of chronic disease conditions, specifically cardiovascular disease. So definitely some great benefits in that direction. Obviously, with any diet, we also want to include exercise as being key to that list, and not just a diet alone. You must exercise. Sitting still does not get you very far in the slightest. And the biggest thing I hear about from all Alaskans, a lot of my patients that are older, and that's a big population of my patients I do see, is that, well, in the winter, I don't want to get out there and slip and fall on the ice. Hey, I understand that. However, find some way to be exercising. If that be working out at home, on a treadmill, walking on a treadmill, riding a bike at home inside, or belonging to a gym. Or third thing, if you don't want to spend any money, go walk around a mall. Don't buy anything. Go walk around. I mean, you got these huge malls in Anchorage. You could spend a good 35, 40 minutes walking around a mall and actually get exercise. And not taking the escalator. I'm just going to go upstairs and walk around, but cruising around, taking the stairs. If you can do such things, you can find free exercise lots of places, and there's no excuse not to be getting that. And we're not going to sit here and debate, exercise being healthy for us. We know that it is. Have yet to see a study that exercise is bad for us. I'm sure we'll never even see one in the first place. So we'll see what happens in that direction. So those are kind of the main components. We'll try the computer here again, folks. Some main components to this Mediterranean diet that I think have a lot of merit, and people can take certain aspects of that and apply it to what you're currently doing. Very simple stuff: fruits and vegetables, healthy oils. Again, I'm not saying to start drinking wine, but if you are, 5 ounce glass of wine a day, probably not. And again, red wine would be the choice versus white wine. Okay, based on what we know about the content of these grapes that make up these wines. That's about 2 minutes till the bottom of the hour break. Okay, good. I don't have a clock in here, folks. Sorry about that. So kind of the key components of that. And it's a way to be eating, right? And, of course, these will combine together will hopefully help you create a diet that's going to help you lose weight if you need to, or maintain healthy weight and improve your chances of living a long life disease-free, hopefully. We got about a minute and a half left here. Again, some reminders. We do have a House Bill number 7, been introduced in the House by Kurt Olson, that is suggesting to put restrictions on the practice of naturopathic medicine here in the state of Alaska. We are encouraging all Alaskans to contact your local House members and write letters, fax it, email it. You can find their information online at house.legis.state.ak.us. I think that's what it was. That's for the House. The other one's for the Senate. On that site, you can find your representative, click on them, and their information to contact them down on Geno's available. And we please encourage you to let them know you do not want to have any bill coming across the effort to decrease your access to health care here in the state of Alaska. All right, folks, it's the time for our 5-minute break here. We'll be back in a few minutes, and hang in there.
Now here you go again. You say you want your freedom. Well, who am I to keep you down? It's only right that you should play the way you feel it. But listen carefully to the sound of the lonely.
I was talking with a friend of mine, said a woman that heard his cry, told him that she loved him so.
Hi there, folks. It's Dr. Ellenburg. Welcome to the Medical Show here on Fox News Talk 1020 AM, 95.5 FM. If you got questions about your health or questions about our show, to give us a call here at 522-1020, 522-1020. Well, luckily for little tiny iPads here, I actually had my show on my email today, so we'll get back to the rest of our show. I pretty much covered everything I wanted to cover on Mediterranean diet, so hope you found that part interesting. We're going to get on talking about here something that many of us don't hear much about until we get older, and that is a condition called age-related macular degeneration. So a little bit of anatomy is always a good thing to understand. What is this condition? So the macula is part of the retina. And the retina is the back part of your eye, and the macula is where your higher, basically vision acuity takes place. So you have your vision center basically within the retina of your eye. It's called the macula. And what can happen to the macula is you can either have a problem with the circulation to it, which is basically a lack of blood flow, or you can also have the growth of vessels into the macula directly. And so you have a wet and a dry type of AMD, or known as age-related macular degeneration. And it can affect a lot of people as we age, and can be a big cause of blindness in the elderly. So it's a big deal. And something that's recommended to a lot of people for cardiovascular disease prevention and to avoid, say, strokes or heart attacks is the regular use of aspirin. And typically the use of aspirin in a dose somewhere around 81 milligrams, or a baby aspirin, daily. Aspirin has been around for over 100 and some odd years. Long-term aspirin use can damage the lining of your stomach if you're taking lots of it over a long period of time. But one thing we haven't seen before that has now been seen in a few different studies, and this one study was done in Australia, is looked at a very large population-based eye study report that found an association between 15 years of regular aspirin use and development of what's called wet age-related macular degeneration, which can cause blindness. So it increased the people in this particular study had twice the risk of those who were not taking aspirin of developing AMD over this 15-year period of time. And the concern is that this is going to scare people from taking aspirin, and it's certainly, I can see why it could do that. They're suggesting here that the protective effect of taking aspirin outweighs the possible side effect in this case of developing wet macular degeneration, or AMD. And, doubling the risk does sound bad, but they're saying the real risk for these folks is that, if you don't take aspirin, maybe you may end up having, a heart attack or a stroke. Well, in my reality, where I come from is I'm not a big fan of using drugs you don't have to, and it's not to say that herbs or other supplements aren't drugs. In a sense, they are, but typically with way less side effects. So, first of all, the question here to ask is, if you're taking an aspirin to prevent a stroke or heart attack, what is that actually doing? Well, what it does actually helps thin your blood out. And one thing, if you suspect somebody is having a heart attack or having a stroke, it's never a bad idea to give them some aspirin right on the spot. Make them chew it up. You might even save their lives doing that, okay, because it's fast acting. Now, that's more for an acute situation, but in the long term, if you had a heart attack, for example, or you have cardiovascular disease, you have a history of strokes in your family or even heart attacks, and the doctors are recommending for you to take aspirin, you may want to consider something to take instead. So what are some alternatives? What are some different things someone can be taking that might help out eye health? Wow, imagine that. One thing on top of the list is fish oil, or in this case, omega-3 fatty acids. And fish oil specifically has two types of omega-3 fatty acids known as EPA and DHA. And what's great to know about that is that, by the way, EPA and DHA are also found in high concentrations within the retina of the eye. So they're actually good for eye health. Fish oil, in this case, or the EPA and DHA, can also come from other sources besides fish oil, but the main source is fish oil, can thin your blood slightly, and certainly not to the level that I think aspirin does, but it may be all you need. Furthermore, we know that fish oil, in this case, is anti-inflammatory. Inflammation is definitely involved in cardiovascular disease, so it's, again, another helpful use if you're concerned about keeping your blood at a better ratio in the sense of being thinned out slightly in comparison to taking aspirin. There's also a thing called nattokinase. Nattokinase is made from fermented soybeans in a form what's called natto, N-A-T-T-O. Nattokinase has been out for many years and can be taken on a regular basis very safely. Probably has the ability to thin your blood a little less than aspirin, but definitely, if I had to guess, I'd say about 50% the strength of, say, an aspirin, baby aspirin, to keep your blood slightly thinned out. what's the point of keeping your blood thin out? Well, that's if your blood's too thick, it can clog, and then you'll have a heart attack if it's in your heart, or you'll have a stroke if it's in your brain. So these are things that obviously are extremely important, and you don't want to have that. And so a lot of times people even put on, the far end of the story, of course, and people put on Coumadin, which is basically was a rat poison back in the good old days, also known as warfarin. Is quite strong, and it's no comparison whatsoever to taking aspirin, and requires typically getting a blood test done every 2 weeks for a period of time to make sure you're not taking too much, where you actually might bleed out and make your blood too thin. Besides nattokinase, I've mentioned fish oil. I would be remiss if I didn't mention lumbrokinase. Lumbrokinase is made from earthworms and is a lot stronger form of in comparison to nattokinase, and can also be used to thin the blood naturally. Vitamin E has a slight effect as well. So there are several different alternatives in this case that one can be doing besides taking aspirin for cardiovascular purposes. And most of these things are fairly inexpensive for the most part. Lumbrokinase is not, because of how it has to be collected from the earthworms that's basically making it. It has this enzyme, and then it helps to help thin the blood. So a very interesting study. This is not the first study to demonstrate that aspirin low dose may increase the risk of age-related macular degeneration. So please keep that in mind. Even though the benefits might outweigh the risk, I think I'll vote for taking something different than affecting my eye health, because you definitely do not want to lose your vision or increase the chances that you might over a longer period of time. All right. Well, again, this is Dr. Michael Ellenburg. It's our medical show here on Fox News Talk, 1020 a.m. Also find us online at 95.5 FM. Sorry, also simulcast on the radio at 95.5 FM and online at foxnewskoan.com. Questions about your health, 522-1020. Give us a call. I'll be happy to talk to you about your health or about our topics. We haven't discussed vitamin D here in some time, and I think it's worth bringing that up again. And there was a very interesting study that actually can help us talk about a few different points looking at vitamin D. That appeared. Where did that appear here? Did he put down where it's from? It was on Dr. John Cannell's website, vitamindcouncil.com, vitamindcouncil.com, and was entitled Vitamin D Status of Exclusively Breastfed Infants. And so this study was done and looked at in New Zealand breastfed infants who were only being breastfed and giving nothing else, and followed them from starting at age 2 to 3 months. Actually, here it is, the Archives of Disease in Children. Archives of Disease Children is the name of the journal. And it looked at 100 different infants, now, whose average age, start of the study was around 10 weeks, okay? And they reported the following. So, first of all, when talking about vitamin D, and you hear it over again on my show quite a bit, get your levels checked if you're an adult and you live in Alaska, okay? You may have low vitamin D, and that can affect so many different parts of your body, from cardiovascular disease to your brain health to your ability to fight infections to keeping away diabetes, for that matter. Okay, all vitamin D has been involved in all facets of that type of disease conditions. They found that through research. We've talked about in the show a lot over the last several years. So the blood test itself is called a 25-hydroxy vitamin D. The low end of the range for vitamin D is 30, and the high end is 100. And we're not even sure if those are the best levels. All I can tell you is that since doing vitamin D testing, I've seen the lowest level start at 10, next one at 20. Now we're at 30 as being the lowest level we want to see people to have you in range. If you're 35, you'd be in range. On the low end, you'd be in the range, but you'd be in the range. So in this study, about 100 infants, their average level of vitamin D is around 21, so they were deficient. And in all, about 24% of the infants had a very low level of vitamin D that was under 11, which actually is associated with developing rickets, which is a disease associated with having a very low vitamin D. Infants enrolled during the winter part of the study had a median level of around 8, while infants tested in the summer had a median concentration of about 30. And the highest level of any infant was around 40. They make a note here. It says, because of ozone depletion in the southern hemisphere, New Zealand's peak summer UV index values are 40% greater than at corresponding northern hemisphere latitudes, which would include Alaska. How about that? So, and that gets back to us. So in Alaska, we don't get any vitamin D from the sun except between basically about April to about September. And that's because a lot of the ozone layer that is up here that covers our state absorbs UVB, ultraviolet B radiation from the sun, which is what stimulates the production of vitamin D in our skin. The other part of the study that no one even mentioned, which we need to mention, is if they're being exclusively fed by mom via breast milk, what is their other source of vitamin D? Anyone? Well, it'd be the sun, if they actually had the babies out in the sun. Now, beyond that, if they're drinking, breast milk, mom's going to have vitamin D on board as well. One could surmise, this was not done in a study that I'm aware of, but it'd been very interesting to see what mom's vitamin D levels were initially, maybe while they were pregnant. Because as a female, and if you're pregnant and having a baby, you're the vessel, right? You're the source. You got all the nutrients and the good stuff inside of you to help grow this child inside. And believe me, if you got vitamin D on board, it's going to be used for your child as well. And so if you have a low status of vitamin D upon pregnancy and don't supplement with vitamin D while you're pregnant, your child is going to come into the world with low level of vitamin D as well. Okay? And this is just standard medicine stuff here. There's no alternative. This is facts. So really important to consider that. And if you are a mother who is currently pregnant, you want to definitely take more than the RDA amount, which is 400 international units a day. That's so you don't get rickets. Again, the disease associated with a very low level of vitamin D in your body. I am not going to give out an exact dose take on the radio by any means. Discuss that with your provider, but definitely 400 international units a day is certainly not enough. And definitely in women who end up having postpartum depression, also called baby blues for a different term, I think vitamin D is a huge area which is often overlooked in these women who are having depression after pregnancy. On top of that, also looking at thyroid function and essential fatty acids as well, because whatever fats you have on board are going to be used to help make your child's brain, okay? Unless you're taking healthy fats and eating healthy fat foods while you're pregnant, which you should be anyways, to help that child's brain develop appropriately. They have a very interesting comment here Dr. Cannell makes at the end of this article. He says, while infants should still receive some sun exposure, just remember they may burn faster than adults, especially while they are vitamin D deficient. It seems those that are more deficient in vitamin D, they burn less. And he says historically, it's been considered that infants were actually possibly hidden away by their Paleolithic mothers and got most of their vitamin D from breast milk and not from sun exposure back in the great old days, like 10,000, 20 years ago type stuff we're talking about here. So very, very interesting. He does have a blog on here. Again, I'm not recommending this dose. I'm just saying it's a blog. And comments, he says, we have women, I've been on here before, mothers who supplement with vitamin D at 5,000 IUs a day or more can give their child enough vitamin D in their breast milk. I'm not sure that exact number. Just passing this along. To read more about this, you can look at vitamindcouncil.com or maine.org. It's one of the two. Online from Dr. John Cannell, MD. It's the best site online for information on vitamin D. So please check that out. Okay, again, folks, it's Dr. Michael Ellenburg. If you have questions about your health today, this is the place to call. That's 522-1020, 522-1020. All right, and let's talk about kidney disease here for a while, because it's really an important factor, and it's important to understand what do your kidneys do for you. And anybody out there who's ever had a family member who had a chronic kidney disease, or somebody who died because of kidney disease, unfortunately gets a lesson in medicine that you won't ever forget of how extremely important your kidneys are. Your kidneys filter all of your blood. They filter all your blood every single day. And they are phenomenal filters. If you don't have kidneys, you cannot live without them. If they're failing, you eventually may need to be put on dialysis, where we're going to use things like hemodialysis, where we take your blood out and put it through special filters to draw out the waste products and toxins that your kidneys should be getting rid of, but they can't get rid of because they're compromised. Your kidneys also keep a lot of important things that aren't supposed to go out through them. Imagine a filter that's not working right, so now things are being lost in the filter into your urine and out of your body. Things like potassium, for example. Things like vitamin D. Kidneys actually are involved in production of vitamin D in the body. People who have chronic kidney disease can also start to have problems with making blood. You have a hormone in your kidneys called erythropoietin, or EPO, which stimulates the production of red blood cells in your bone marrow. Yes, you can live without one kidney because you got two. As long as you got one good functioning one, you're in good shape. But if you have a poor filtering problems with your kidneys, it can totally affect your health and cause and end result could possibly cause even your death if they don't work right. And your kidneys typically are tested on a very easy screen on lab work people have done millions of times a year in various places throughout the U.S. for mostly a screening and looking at two different things. And those are called a BUN, or blood urea nitrogen, other one being creatinine. These are both different products of protein metabolism in your body. It means food you're consuming protein you're consuming is being broken down, and we know that blood urea nitrogen, the nitrogen levels can vary based on the intake of your food, and creatinine can also vary within the blood. And so we have, well-established reference ranges for these blood tests that are commonly done, very inexpensive, to give people a good idea as how is my kidney function doing. And so, for example, if someone had a very high creatinine or a very high blood urea nitrogen, it could indicate possible kidney damage. There are tests that have been done beyond that, but as a screen, it's a great screen looking at. Furthermore, if somebody has a urinalysis done, which we do frequently, of course, in our practice, for screening patients on first-time lab work, for example, or even follow-up lab work, is there are things that should not be showing up in the urine. For example, on a urinalysis, you typically should not be seeing sugar or glucose, same thing. In this case, glucose in the urine. You should not see protein in the urine, okay? You typically should not be seeing red blood cells in the urine. You should not be seeing crystals or sediment in the urine, which could be an indication of possible kidney stones or a propensity to possibly have kidney stones if you're seeing sediment within the urine. Those are kind of the big ones. White blood cells in the urine could indicate possibly a urinary tract infection. So we can use a urinalysis for a lot of diagnostic tools, and a lot of good things in there is looking at what shouldn't be in your urine. And if these things are showing up, we're beginning to see damage taking place somewhere in the body. Not specifically, and it may not be the kidneys. For example, if somebody has a really high blood sugar, the kidney function could be actually in good shape, but there's so much sugar in the body that the kidney can't possibly take all of it out. And so you start seeing sugar, in this case glucose, show up in the urine, which is a sign of problems. Protein in urine typically can indicate damage to either the kidneys or damage to the lining of arteries within the body. People who have diabetes long-term may even have a test called a microalbumin test. Now, albumin is a really important protein in your body for antioxidant capacities. It's involved in hormones in the body as well, and is a huge measure typically of overall health status. And it can vary, of course, based on your protein intake, but you typically should not be seeing any albumin in your urine. If you are, it can also indicate some damage to the kidneys as well. So one area that brought this up is this article that I'm not going to get much into, but it was just saying that kidney disease is a very powerful predictor of death and diabetes. This appeared recently in the Journal of the American Society of Nephrology, a study of kidney disease. And there are nephrologists, of course, for kidney specialists. But kidney disease is a very important thing, and many of us, if we don't have kidney problems, and I hope that many of us never have kidney problems at all, don't realize the importance of your kidneys and what they're actually doing for you. And it's important to take good care of those kidneys of yours. I had the unfortunate experience of having a father who passed away from a type of cancer called multiple myeloma. And he unfortunately developed at the same time as cancer was diagnosed, called myeloid kidney, where basically these plasma cells, almost in a sense, cause a poisoning of his kidneys. And basically he had cancer and chronic kidney disease happen all at the same time. It was a bad place for him to get into, but I had the, sometimes when you have unfortunate things happen in life, especially in medicine, it's an opportunity to learn something as well. And I learned a lot taking care of my father, that's for sure, and having his kidney problems, and working with a great nephrologist here in Anchorage, and I will give him a great pat on the back, and that was Dr. Jeremy Gittimer. I do thank you for your great help with my dad during his time he was alive. But if you have kidney problems, that's a good clinic to go to. I think it's Alaska Kidney and Hypertension Clinic. That's Dr. Jeremy Gittimer. All right, we got a couple of minutes left here. What can we finish? We didn't get over today. We did talk today about the Mediterranean diet and the importance of looking at that and making changes in vitamin D. We also talked about measurements in vitamin D, and again, some important reminders about vitamin D measurements. If you are taking vitamin D, it's important, if you do go in for a test on your vitamin D, to not take the vitamin D before your test. For example, if you went in at 9 o'clock in the morning and you took your vitamin D 2 hours before, you could falsely raise your vitamin D levels on your test and give your provider an inaccurate measurement of your vitamin D. So it's important if you're getting a vitamin D test done again, or if you've been tested for the first time and you actually do take vitamin D, do not take it the same day as the test, or don't take it so after the blood test is done that day, then take it afterwards. Okay, you get a much better measurement. The same can be said for thyroid hormone replacement. And people who are taking thyroid hormone like Synthroid, we kind of recommend patients to get their labs done in the morning, and after the labs are done, then take their thyroid hormone, because that can also spike up, or in this case, bring down appropriately a thyroid or thyroid stimulating hormone or TSH levels, and make them look like they're great when they're not. So it's important to remember that part about the vitamin D. And also B12 as well, for that matter. So it's, I always tell a lot of patients, on the safe side, the day you do lab work, don't take any vitamins until after you've given your blood. Then go take them. Very easy to do. We have about a minute and a half left, I think, roughly, or 2 minutes. I want to make another reminder about this. So House Bill number 7 has been introduced in legislative 28th session this year down in Juneau. It was introduced, I believe, on this 9th, and is now in Labor and Commerce Committee. And House Bill number 7 is important for people like myself, because House Bill number 7 is suggesting to impose restrictions on the practice of naturopathic medicine here in the state of Alaska. If this bill is voted through the House and voted through the Senate, it will severely, and I mean severely, impact the type of health care that we've been providing Alaskans in this state since 1986. And I would highly encourage you to visit, if you don't have your access right in front of you, of course, or sort of thing, to your local district house member, look that up online. You can go to house.legis.state.ak.us and find who your representative is for your certain part of Alaska you live in, and please send a note or an email or a fax or even a phone call to their office and let them know that you do not support restrictions on naturopathic medicine here in the state of Alaska, because it will put restrictions upon your access to health care. The bill is currently in the House. If you also want to send a note at the same time to your Senate representative as well, that'd be a great idea too. You can do that as well online, and the email is right there. You click on it, pulls up on your Outlook or what you got on your computer, and away you go, and you send a quick note to them. It's very simple to do. And the bottom line is telling them, please don't change anything. I do not want to have my access to health care limited here in the state of Alaska. All right, folks. Well, thanks for listening today. Sorry for the little problems there earlier on with my computer, but that's how computers go in the world sometimes. Thanks for tuning in. During the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com. That's drellenburg with a U.com. Thanks for listening, and we'll talk to you next Monday.
A folded hand, a poker there. All new directions must go everywhere. Big round people in a cool little square. Or you can cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family. No melted ice cubes in a